If there is one endodontic book that attempts to answer not only how root canal treatment is performed, but also why we make a particular diagnostic or therapeutic decision, it is Cohen's Pathways of the Pulp. But the more important question for dentists today is whether the 12th edition still justifies the time required to work through such an extensive volume and whether it can genuinely improve clinical decision-making. If there is one endodontic book that attempts to answer not only how root canal treatment is performed, but also why we make a particular diagnostic or therapeutic decision, it is Cohen's Pathways of the Pulp. But the more important question for dentists today is whether the 12th edition still justifies the time required to work through such an extensive volume and whether it can genuinely improve clinical decision-making. This is the 12th edition of Cohen's Pathways of the Pulp, edited by Louis H. Berman and Kenneth M. Hargreaves and published by Elsevier in 2021. The book belongs to the field of endodontics and is designed as a university textbook and professional reference source. The first section covers fundamental diagnostic and clinical procedures, the second addresses biology and advanced scientific topics, and the third focuses on outcomes, complications, and more challenging clinical problems, including resorption, trauma, vital pulp therapy, and restoration of the endodontically treated tooth. 3 additional chapters are available in the digital content. The book itself states that the first section focuses on fundamental clinical concepts for students, while the advanced sections are intended for more advanced students, residents, and clinicians. The organizational logic of the book is sound. The reader progresses from diagnosis and biology to treatment, complications, and outcomes, presenting endodontics as a discipline that is not reduced merely to mechanical root canal instrumentation. The 12th edition also introduces substantive changes in content. A new chapter has been added on lesions that may mimic endodontic pathology. The chapter on iatrogenic events has been thoroughly revised and expanded to include inferior alveolar nerve injuries, and the chapter on resorption has been updated. This is clinically significant because one of the most serious errors in endodontics is not unsuccessful instrumentation, but an incorrect diagnosis. The book consistently demonstrates that a radiographic finding is not a diagnosis in itself. It must be correlated with the patient's history, clinical examination, pulp testing, and differential diagnosis. The discussion of cone beam computed tomography is particularly useful. The position of professional associations is presented. This imaging modality should not be used routinely for screening, but rather when the anticipated benefit outweighs the risk and when two-dimensional imaging is insufficient. At the same time, its value is clearly explained in cases involving complex anatomy, calcified canals, suspected vertical root fracture, failure of previous treatment, perforations, and surgical planning. The scientific value of the book is high, although it is not uniform across all areas. Where higher quality data are available, the authors draw on systematic reviews, meta-analyses, randomized controlled trials, guidelines, and large observational studies. The chapter on outcomes is particularly valuable because it distinguishes between what clinicians assume and what can actually be associated with prognosis. The presence of a periapical lesion shows a strong negative association with healing, while the quality of the definitive coronal restoration has a major influence on the final outcome. The practical message is clear. A well-instrumented and obturated root canal does not represent a completed treatment if the coronal seal is inadequate. More importantly, the book acknowledges where the evidence is insufficient. There is a clear technical rationale for the use of the operating microscope, but its independent effect on the final outcome is difficult to demonstrate. Disagreement within the literature is presented regarding the size of apical preparation, the selection of certain irrigants, and the number of treatment visits. In the debate over single versus multiple visits, the authors explicitly state that larger and methodologically stronger randomized trials are needed. This is an important strength. Clinical tradition is not equated with evidence. A similar critical approach can be seen in the discussion of root canal disinfection. Regarding calcium hydroxide, the book states that more recent clinical studies and systematic reviews have not demonstrated reliable additional bacterial elimination following chemomechanical preparation and concludes that its effectiveness, when assessed using microbial culture, is limited. Chlorhexidine has produced favorable laboratory findings, but there is substantially less clinical evidence, and the reader is cautioned that laboratory results cannot simply be extrapolated to patients. Even the results of combining certain intracanal medications are presented as contradictory. This distinction between levels of evidence makes the book scientifically more rigorous than a manual that merely prescribes a protocol. One of the most interesting sections is vital pulp therapy. The book presents data on direct pulp capping and pulpotomy, including randomized trials and pooled analyses, and demonstrates the important role of calcium silicate materials. At the same time, however, it notes that clinical studies are heterogeneous, protocols are not standardized, and international recommendations are not fully consistent. Pulpotomy of mature permanent teeth with a clinical diagnosis of irreversible pulpitis is particularly interesting. Very encouraging results from individual studies are presented, but these should not be interpreted as universal authorization to perform pulpotomy on every symptomatic tooth. Case selection, control of bleeding, removal of infected tissue, and the quality of the restoration remain critical. Regenerative endodontics illustrates even more clearly the distinction between promising biology and the level of clinical certainty. The book links stem cells, growth factors, and scaffolds to regeneration of the pulp-dentin complex, but openly acknowledges that much of the evidence comes from laboratory and animal models, case series, and retrospective studies. For mature teeth, it explicitly states that additional evidence is needed before regenerative approaches can be reliably compared with conventional root canal treatment. Clinical applicability is perhaps the book's greatest strength. The reader is given a framework for decision-making, when additional imaging is justified, when non-surgical retreatment should be considered, when surgery should be considered, when extraction and implant placement may be appropriate, and how tooth prognosis, restorative status, risks, costs, and patient preferences should be incorporated into the decision. In the chapter on periradicular surgery, clinical decision-making is defined as a combination of the best available evidence, clinical judgment, and patient values. The book is also rich in radiographs, tomographic images, clinical photographs, histologic specimens, tables, diagrams, and long-term follow-up cases. The visual material often directly illustrates a diagnostic problem, complication, or course of treatment. The 5 greatest strengths are the breadth of its content, the integration of biology with clinical procedures, serious consideration of prognosis and levels of evidence, strong differential diagnostic coverage, and extensive clinical documentation. The limitations are real. The book is too extensive to serve as a quick chairside reference, and the level of evidence is uneven. Some recommendations are supported by meta-analyses and randomized trials, while others rely on laboratory data, observational studies, or expert interpretation. This edition was published in 2021, and some of the guidelines it cites date from earlier periods. This does not mean that they are automatically incorrect, but rapidly evolving areas such as 3-dimensional imaging, regenerative endodontics, vital pulp therapy, biomaterials, and pharmacologic recommendations now require consultation of more recent guidelines and literature. The publisher itself cautions that knowledge and therapeutic information change over time and that current drug information must be verified. Who will benefit most from this book? An endodontic resident and an endodontist, because it is sufficiently comprehensive to serve as a reference for years. It provides an excellent foundation for students, although they do not need to read every section with the same intensity. For a young dentist, it can substantially improve diagnostic reasoning and prognostic assessment. For a general dentist, the chapters on diagnosis, treatment planning, complications, emergencies, vital pulp therapy, and restoration of the endodontically treated tooth offer the greatest practical value. For educators and researchers, it can serve as a map of the literature and of unresolved questions. A dentist who is looking only for brief step-by-step protocols and performs endodontic treatment infrequently is unlikely to make full use of its scope and does not need to buy this book. Is the book worth the time and a place in a serious professional library? For someone seriously involved in endodontics, yes. Its greatest value does not lie in a single, perfect, technique, but in connecting diagnosis, biology, treatment, restoration, prognosis, and patient preferences. Its greatest limitation is that a work of this size cannot remain equally current in every rapidly developing area and that the quality of evidence is not the same for every recommendation. For this reason, it is best used as a university textbook and specialist reference source rather than as an immutable clinical guideline. Most dentists do not need to read it from the first page to the last. Its real value lies in returning to it when you want to verify a decision or explore a topic in greater depth. If the question is whether Cohen's Pathways of the Pulp is worth the time required to read it, the answer is yes, particularly for those who want to understand not only how endodontics is performed, but why a particular treatment succeeds, where the limits of the evidence lie, and when the best decision is actually different from the one we are accustomed to making. The book explicitly limits the routine use of cone beam computed tomography and relates its use to the balance between benefit and risk, while the chapter on outcomes openly discusses limitations of the evidence and prognostic factors. The limited and heterogeneous evidence base for vital pulp therapy and regenerative endodontics is also explicitly acknowledged in the text.